Moving on to the PD-L1 high, PD-L1 low. So it's positive, but it's not reaching that 20. For survival, the more objective and more important measure, pembro plus chemo here is beating cetuximab plus chemo. Not as much as with the PD-L1 highs, but here, what I want to point out is that you need the chemo backbone. If you, I'm not showing you for reasons of trying to simplify a complex data set, but pembro alone did not beat cetuximab plus chemo the way pembro chemo beat cetuximab plus chemo. And so the answer for PD-L1 1 to 19 is pembro plus chemo. I think a very accepted answer. Again, the relationship between the curves different from what we historically expect. There's actually no PFS advantage, but the survival advantage is quite clear, making it the right thing to do. If that's a little muddy for you, with apologies, it gets muddier with the PD-L1 of 0. And fortunately, this is a rarer subgroup in head and neck cancer. Head and neck cancer is one of the cancers most amenable to immunotherapy, probably tied with lung cancer and just behind melanoma. But here we see that when we add pembro to chemo and compare it to cetuximab plus chemo, we have no survival advantage. They're very similar. These curves cross over each other more times than I can count. And for progression-free survival, we're certainly not beating. If anything, there's a very weak trend in the wrong direction, albeit with small patient numbers. And so here there's a divide in the head and neck community, with some people giving pembro plus chemo first and reserving cetuximab later for later use, some giving cetuximab plus chemo and reserving immunotherapy for later use. And honestly, it probably doesn't matter. The order outcomes are pretty similar, and it's not a point of passion for me. I think the key point is that either is acceptable. Cetuximab and pembro add to chemo similarly.